Imagine a seed used like a quiet button for the belly. Toast it. Chew it. Steep it. In markets from Rome to Rajasthan, it's the after-meal ritual for bloating and gas, and a traditional tea that supports milk production for nursing mothers. That seed is fennel, Foeniculum vulgare. Today, tradition versus science, what actually helps, infant safety, and how to use it tonight. Fennel is an aromatic plant in the carrot family. We eat the bulb, crisp, the fronds, herb, and the seeds, spice or tea. The seed's sweet, anise-like note comes from anethole, with estragol and fenchone in smaller amounts. Digestive comfort, infant colic rituals, and nursing support center on the seed. Italy, shaved fennel with citrus. India, toasted seeds after meals, breath and belly ritual. MENA, fennel tea for digestive comfort. Many places, warm fennel infusions shared with new mothers. Tradition isn't proof, but it points to gentle, food-level practices. Fennel seed contains volatile oils, anethole lead, flavonoids, and other plant compounds. Lab and small clinical studies suggest carminative, gas-reducing, antispasmodic, cramp-easing, and mild soothing actions on smooth muscle. Signals of benefit, with variation. Reduce post-meal bloating and gas, soothe infant colic, and infant-appropriate formulas support milk production in nursing mothers, alongside latch and frequent feeding. Use fennel as supportive food/tea, not a standalone treatment. Culinary amounts of fennel seed are widely used and generally well tolerated. Still. Infants, only clinician-approved, infant-specific fennel preparations. No essential oils. Nursing, tea may support supply, responses differ. Work with a lactation consultant. Pregnancy, culinary use is typical, avoid high-dose extracts unless guided. Allergy, caution if you're sensitive to APACE, carrot/celery, meds/conditions, if on hormone-modulating meds, anticoagulants, or with liver concerns, ask your clinician. Essential oil, highly concentrated. Not for internal use unless directed by a qualified professional. Not for infants. Estragol note, present in small amounts, at tea/culinary levels, widely used, avoid chronic high-dose extracts. If your belly drums after meals, think gentle plus consistent. 3 options. Chew and go, Muquoz style. Lightly toast 1/2 to 1 teaspoon seeds in a dry pan until fragrant, cool. After meals, chew 1/4 to 1/2 teaspoon slowly. Why? Aroma plus chewing stimulate digestion, carminative action may move gas along, simple fennel tea. Lightly crush 1 teaspoon seeds. Add 250 milliliters hot water, 95 degrees C. Cover and steep 10 minutes, strain, sip warm. Why? Warmth plus volatile oils plus time equals gentler gut, cook it in. Add 1/2 to 1 teaspoon whole seeds to roasted vegetables, lentils, or tomato sauce. Why? Flavor makes habit easy. Colic is exhausting. First, see a pediatrician to rule out red flags. If advised. Use only infant-appropriate fennel preparations, pharmacy emulsions or pediatric teas at very low strength. Dose or frequency equals clinician-directed. Never give fennel essential oil to infants. Sometimes fennel tea for the nursing mother, not the baby, is suggested in culinary amounts, again, with clinician or lactation guidance. Fennel tea is a traditional galactagogue, it may support supply for some mothers. What matters most, effective milk removal, latch, positioning, frequency. Practical. Tea, 1 cup per day of light fennel tea, 1 teaspoon seeds, 10-minute covered steep, for a few days, note comfort and pattern. Hydration and calories, eat hearty, drink to thirst. Get help, connect with an IBCLC if supply is a concern. Choose whole seeds, aroma ground. Look for green-tinged, sweet-smelling seeds. Freshness beats everything, buy from high-turnover shops. Store airtight, cool, and dark. Label and date. Best within 6 to 12 months. Avoid musty, gray seeds. 1. Classic fennel tea, 1 cup. Lightly crush 1 teaspoon seeds, add to mug, pour 250 milliliters hot water, cover 10 minutes, strain, sip. Add ginger slice, honey, lemon peel. 2. Orange fennel salad, refreshing. Shave 1 fennel bulb thin. Add orange segments, olives, parsley. Dress, olive oil plus lemon plus pinch crushed fennel seed plus salt or pepper. Finish with fronds. Pick 1 habit for 7 days. After meal, chew, 1/4 to 1/2 teaspoon toasted seeds. Tea time, 1 cup covered, steep after your biggest meal. Oil bloom 1/2 teaspoon crushed fennel in olive oil at dinner start. Track 3 things daily, 0 to 10 bloating, gas or discomfort, post-meal ease. Look for trends. Myth, fennel cures colic. Fact, some infant-safe formulas may soothe, pediatric guidance is essential. No essential oils for babies. Myth, more fennel equals faster results. Fact, gentle plus consistent beats heavy-handed, too much can taste soapy or upset digestion. Myth, any fennel works. Fact, fresh whole seeds lightly crushed before steeping or blooming are best. Myth, tea replaces breastfeeding support. Fact, tea can support, latch and frequency drive supply. Buy fresh whole seeds. For bloating/gas, chew 1/4 to 1/2 teaspoon toasted seeds or drink 1 cup covered steep tea, 1 teaspoon seeds, 10 minutes. For nursing support, if appropriate, 1 light cup/day and work with an IBCLC. For infant colic, pediatrician approved only, use infant-specific formulas, never essential oil. Track your comfort for 7 days, keep what helps. Fennel is a quiet button you can keep in a jar, a small seed with a long memory of markets, midwives, and after-dinner tables. Use it with respect. Keep it gentle. Let tradition meet your experience, and let your belly decide. If this helped, like, subscribe, and share. Comment your favorite way to use fennel, tea, chew, or cook.